Hello, my name is Meredith Alderman, and today is October 26, 2025. This is my card for our first presentation in Pathophysiology at the University of New England. So starting off with the definition of disease, it is an acquired or congenital illness in which a physiological process is operating abnormally within the body. For example, chronic kidney disease, where the kidney is not operating properly. Disease classification can be acute or chronic. Acute is short-term and often self-limited with therapeutic applications such as drugs, and chronic diseases persist for 3 months or longer. They can even last a lifetime. An example would be the flu. The flu is often self-limiting and would be acute. Etiology is the cause of the disease process. For example, a burn due to touching a hot stove. The cause would be the hot stove. The pathogenesis of a disease is the evolution of the disease. For example, with that patient who has been burned, if they got a second-degree burn, we would expect to see blisters form as the disease progresses. Symptoms are only exhibited and able to be explained by the patient themselves. They're subjective to the subject. So, for example, a headache or pain, an observer or medical provider cannot measure pain. They cannot validate that a patient has a headache. However, signs are things that can be observed, that can be validated by someone else, such as a provider. For example, this patient that has the flu, if we were to take their temperature with a thermometer and they were shown to have a temperature of 101 degrees Fahrenheit, that would be a sign of the disease process. A syndrome is a group of complications due to a group of signs and symptoms of a disease. For example, metabolic syndrome due to obesity. And diagnosis is done by a provider after they gather all of their information from the physical exam, their history, the tests, the signs and symptoms of the patient, and they make a diagnosis, an informed diagnosis, to validate what the most likely disease process that's occurring in this patient is. For example, with the flu, if someone has had extreme fatigue and a fever and chills all over their body, and then they begin to cough a few days later, runny nose or congestion, then the provider may diagnose them with the seasonal flu. And that can be done after flu testing also. Complications are secondary to a disease process. So, for example, if someone is having an allergic reaction, a complication of the allergic reaction may be that they have shortness of breath for an extended period of time, or that they have low blood pressure after administering medications to help combat the allergic reaction. Prognosis is the expected outcome of the disease process. For example, if a patient is diagnosed with seasonal flu, then the prognosis would be that they would recover fully to be a healthy individual again. And lastly, diagnostic tests. Those are tests such as a CT or an MRI or lab work that we get on a patient that help inform the provider as far as what else is occurring in the body physiologically, and if there are other pathological issues within the body as a result of the disease. And they are very helpful in providing the fullest picture of what's actually going on in the patient.